I wanted to talk to you all about today an entity called sudden sensorineural hearing loss. Unfortunately, it is a condition that is serious and can be treated, but must be treated with a specific, distinct timeline. Unfortunately, I have found in my career that it is often misdiagnosed by many urgent care and primary care doctors in the community. Oftentimes, they diagnose a simple ear infection. When they come to see me, if they come to see me at all, there's no evidence of an infection, and it turns out to be a neurologic loss of hearing. The only way for an urgent care or primary care doctor to make that distinction is a simple tuning fork exam. This is a tuning fork. If you haven't had a physician provide you with a tuning fork examination to appropriately triage and distinguish whether or not you have a sensorineural loss or something treatable like an infection, then that needs to be done. And you should advocate and demand to see an ENT. So this type of hearing loss, which is sensorineural hearing loss or sudden sensorineural hearing loss, can lead to deafness. So is one of the true ear, nose, and throat or otolaryngologic emergencies. If you're referred to ENT in a timely manner, we can do certain things that are imperative in order to preserve hearing and reverse the hearing loss. In my practice, at least 3 patients every quarter come to me beyond the 30-day therapeutic window in order to preserve or salvage hearing, which is unfortunate. So the point of this public service announcement is to emphasize to you as the patient to advocate for yourself. If a primary care or urgent care provider has not performed a tuning fork to appropriately triage your hearing loss, then demand that you see an ear, nose, and throat to appropriately triage and discriminate whether or not you have this relatively common disease entity. If you arrive in our office, there are certain things we always do, including a laboratory evaluation, so oftentimes imaging, and some important treatment modalities, one of which is something called hyperbaric oxygen therapy. There are 20 FDA-approved indications for hyperbaric oxygen therapy, and sudden sensorineural hearing loss is one of them. Unfortunately, I have found that many ear, nose, and throat colleagues in my career fail to recognize or advocate for patients for this imperative treatment modality to salvage hearing. In fact, I have been called recently by the local hyperbaric physician, quote unquote, asked me, "Jamie, why are you the only ear, nose, and throat regionally who calls me about this condition in the last 6 years?" That question was devastating to me, because we as providers need to, and especially ENT, ear, nose, and throat providers, our goal and our commitment in life is to preserve your hearing. So the fact that there's ENT providers not referring for hyperbaric dumbfounds me. It is one of the improved indications for this condition, and it is imperative to start within 30 days of onset. That's why I have partnered with what I consider the best diagnostic regional comprehensive audiology group known as Live Better Hearing, who have sites from all over the DMV to appropriately diagnose this condition so that we can salvage your hearing. Myself and Live Better Hearing will do the appropriate things to ensure your quality of life and hopefully salvage and preserve your hearing, which is an imperative special sense for your ultimate quality of life.